Assalamualaikum and hello ladies and gentlemen. We are proud to present our innovative method. But first, let me introduce our innovative team members led by Encik Muhammad Hafizi Mahmud, team member Cik Faika Zakaria Mahmud, Hairina Nur Ashkin Sharif, Nur Syafini Muhammad, Wan Farah Wahida Cik Zakaria, and Nur Aiman Baharudin. We are delighted to present our innovative method where we are revolutionizing the way radiographer handling portable chest X-ray to minimize cross-infection during the outbreak by reinventing true glass technique. To help me explain why other radiographers need to use the true glass technique, I'd like to share with you the issues that they are facing. They are short of PPE and sanitized resources and increased cross-infection among radiographers to be able to do chest X-ray. These are horrible problems. So to solve these issues, we're reinventing true doors or walls of isolation rooms that was found by Moirano and team. True glass technique solve those issues. We empower radiographers to manage these issues using one single technique that we are proud to introduce to you, the True Glass Technique. True Glass Technique is proven to minimize the cross-infection during an outbreak and still can perform and produce high-quality chest images. To show you how it works, we'd like to present the findings of our preliminary study on a phantom. This is standard projection of portable chest X-ray, where the phantom was placed on hospital bed in anterior-posterior chest projection, the same way the patient is positioned during chest X-ray. The portable unit is placed outside the nurse's recovery bay at a distance of 200 centimeters with a sliding door open. Now, this is chest X-ray with the use of the True Glass technique. Again, the same phantom was placed on a standard projection of portable chest X-ray, but this time with a sliding door closed. The radiographers then simultaneously set the X-ray energy on the portable unit outside of the isolation room so that it is safe and away from the infected patients. Now, with the standard technique, the door remained opened. The risk of infection is high. The radiographers need to use PPE and sanitize. But in fact, we know that these resources are limited. But now, the radiographer don't have to work like that anymore, thanks to the True Glass technique. The findings from this study has shown a promising results. These are the chest X-ray without glass and with glass that has been exposed in the earlier technique using two types of X-ray energy, 80 kVp and 90 kVp. We then asked two evaluators to rate the set of images, and the findings show that they are moderately agree with each other that the image quality are similar with and without the glass. This has shown that the True Glass technique does not affect the chest X-ray images negatively. By including the glass in the chest X-ray technique, the image quality is remained. The radiographer risk of infection is minimized, and the PPE and sanitized resources can be used for other important events. All the radiographer need to do is to slide the glass door and expose. From this technique, less sanitization, less usage of PPE, reduce contact with infected patients, reduce cross-infection among radiographers, and therefore improve department workflow during the outbreak. We are targeting every single hospitals and stakeholders out there who love to use True Glass technique. This will promote the use of glass door, in particular in isolation room. There are plenty of rooms for us to grow. Therefore, we need more training for the radiographers and research that could be done in order to strengthen through glass technique. Once the techniques start to grow and love this technique, they'll pass it on the radiographers across the country. The true glass technique is ready to use by the radiographers in the isolation room whenever they want. So now, you know what we are building and why we are building it. In Malaysia, the technique is new, and there are no other technique that can solve the issues as good as true glass technique. This technique has been developed with very strong methodological process done by our team. Therefore, we are guaranteed that the true glass technique will become the norm. So you might be thinking why we are the perfect team to reinvent true glass technique. We know the landscape. We have presented the findings at 52nd Annual General Meeting and also Annual Scientific Meeting in front of Malaysian Society of Radiographers on June 24th, June 26, 2022 at Noble Resort Hotel Malacca. We are going to change the way radiographers do the portable chest X-ray when dealing with infectious disease. We have a promising and innovative method, so if you want to take part of this revolution technique, and if you would like to help us in bringing this technique further, please evaluate us to win this competition. And thank you very much.